The 2023 legislative session is finally ended, and we know you're all on the edge of your seats waiting for the latest policy corner. It was a busy session for us. We tracked 85 bills with text, explained and took positions on around 70 of them, followed 68 separate budget items, and commented on roughly 20 bills and budget matters. We've provided our bill tracker to the full body every week of the session to keep them informed on our position. So without further ado, he's Nate Krippus, and I'm Andrew Riggle, and we're here to tell you what went down and what's coming up.
Well, first up, we have the budget and bills that were or were not funded. Some good news is that HB 248, Representative Judkin's bill to create a grant program for ACT teams and a plan for more, did get $1 million. It's less than the $5 million we had hoped for, but we think it will create at least 2 new ACT teams in the state. And with the $50 million for deeply affordable housing getting funded, again, at less than the $100 million the governor requested, we do have at least a start of a community-based mental health system. But we obviously just need much more. Also, we were sad to see that Representative Stoddard's attempt to start a grant program to have a non-law enforcement response to crisis situations or a best practice CIT when law enforcement is necessary in HB 29 didn't get funded. We'll talk more about our plans for mental health policy a little bit later.
In other good news, Senator Harper's SB 106 that made caregiver compensation for parents ongoing did get funded, which is estimated to help about 970 families. This could also help the 250 or so individuals and families that will get off the DSPD waiting list and into services thanks to EAC funding of a little more than $3.5 million. Unfortunately, Representative Ward's attempt at dedicated ongoing funding for 200 folks a year in HB 242 did not get funded. However, there will be $3 million in one-time money to provide up to 8 hours of respite a week to those at the top of the waiting list for a year. And Representative Ellison was able to get an additional 190 individuals funded on the medically complex children's waiver.
A few other items of note, a little funding was provided for an increase to the nursing rate for those coming out of ICFs into the community. It's far less than the governor requested, but it is a start. And while we always focus on getting folks out of institutions and into community-based services, we do want to ensure that folks who remain are able to receive the best care possible. So we were happy to see the $5 million for a nursing home wage increase, as well as $1.2 million plus for an ICF daily rate increase, as our rates are among the lowest in the nation, and $300,000 for quality improvement incentives for ICFs.
Next up, since we got so much positive feedback on our Good Bill, Bad Bill segment last week, we wanted to keep the millions of you out there watching happy. So here we go again.
All right, first up, HB 37 and HB 162 both passed. These created a clear process for voters with disabilities to not have to correct their ballot every year if their signature didn't match due to their disability. Also, a few other voting bills that would have reduced accessibility didn't go through, so some good news. However, HB 304 from Representative Lisby did go through, which is bad. The bill rolls back some good reforms around juvenile justice and will likely result in more students with disabilities being referred to juvenile court and caught up in the school to prison pipeline, as studies show that students with disabilities are twice as likely to be arrested, and 3/4 of kids in juvenile justice have a disability.
Back to the good. HB 129 from Representative Burton, which would have allowed mental health facilities to have a blanket ban on cell phones in secure areas, did not pass. That's the good. We expect some changes over the interim, so we'll continue to work with the sponsor on the legislation. Next up, HB 61 from Representative Wilcox. This bill creates a program for schools to, among other things, add more SROs or law enforcement, which could lead to more kids tied up in the criminal justice system. It did pass, so that's bad.
Some additional good news is that HB 177 did not pass. The bill was originally aimed at a potential move of the state hospital, but was substituted to create a commission to study the hospital's role in the state's mental health system. While not a terrible bill, it would make the comprehensive study that we're going to talk about a little later a little more difficult to get through.
The bad bill is one we haven't mentioned before, SB 16 from Senator Kennedy, which prohibits certain treatments and surgeries for transgender youth. The Fourth Circuit ruled that gender dysphoria is a disability under the ADA. Given that this bill restricts treatment for those with gender dysphoria while permitting other individuals to continue to receive it, we believe this bill under the Fourth Circuit ruling violates the ADA. We informed the legislature of this as well as the governor, and it is something the DLC will be monitoring closely.
Finally, and you know we love to end on a good bill, is HB 385. This bill impacts the guilty but mentally ill plea by helping folks access treatment and allowing judges to consider time in treatment when sentencing. It's a small step, but a good one. So we want to thank Representative Abbott for working on this.
So now we have to consider what's coming up, and it looks like we might be busy during interim. Who knows? You might even get some additional Policy Corner episodes during the summer and fall. First up, we want to thank Representative Judkins for all of her work on behalf of Utahns with disabilities this session. Unfortunately, two bills we were excited about didn't pass. Both HB 510, which codified supported decision-making agreements, and HB 516, which is the comprehensive mental health study we mentioned earlier, will be pushed to interim. We're excited for these bills and will keep you posted on them moving forward. Similarly, we hope to pull together a group of stakeholders to discuss some additional mental health work over the summer.
We also want to thank Representative Ballard for trying to help more families on the waiting list with Medicaid coverage via HB 558, and we look forward to working with her and others on that. There's some good momentum around expanding services for those on the technology dependent waiver and ensuring folks in services have informed choice around Representative Lubay's HB 78. Both of those are going to get kicked to interim, so we hope these conversations can work together to provide more and better services to Utahns with disabilities.
As we noted a few weeks ago, we were disappointed when Representative Daley Provost's HB 252, which increased the income limits for those on the Medicaid Work Incentive Program, failed. We thank the representative for bringing this forward, and she's committed to working on this with her colleagues in the interim. Relatedly, we appreciate Representative Garner's efforts to ensure people with disabilities cannot be paid sub-minimum wage in HB 549, and we hope to continue that conversation as well.
Well, that's what we have for you today. As always, you can find more information on these bills and budget items on our website, disabilitylawcenter.org/public-policy. And as we said, we'll try to provide more updates throughout the year. With that, he's Andrew, and I'm Nate. From both of us, thank you to all those who watched the DLC's Policy Corner this session. We hope it's been fun and informative, and we'll see you when we see you.